let's get you across some other news, because there are calls for health stakeholders to exclude health facilities from load shedding. Both the South African Medical Association and Health Professional Council are concerned that power cuts put the lives of patients at risk. Let's talk about this situation with Dr. Tshwale from the Department of Health. Doctor, a very good afternoon to you. Welcome to the program. So I understand there are to be meetings that involve the Health Minister, Joe Phaahla, and the provinces. What ultimately is the goal?
Thank you very much, and thank you for greetings to your viewers. The meetings that the Minister is going to be holding are a follow-up to some of the meetings that the DG, on the instruction of the Minister, has been having with the HODs in the provinces to do an assessment of the impact of the load shedding on the health facilities. So the Minister would be taking up that discussion immediately when he receives the report from the DG. That report has been finalized, and the Minister will be taking those discussions with the Minister of Public Enterprises, ESCOM, and the municipalities to find a better way in which to establish a process at which the health facilities will be exempted from load shedding.
But these discussions are coming after calls from health sector organizations and even doctors, a petition now having been started calling for health facilities to be exempt from these power cuts. Are you having these meetings because as a department you were not aware of A, the great inconvenience that is load shedding for healthcare workers, B, the potential risk, danger to the lives of patients as a result?
No, I think these discussions have been taking place for some time. I think that you would recall that ESCOM has responded to this to the effect that it's not necessarily them who, they made a mention of the fact that they are not the ones who would exempt any facility from load shedding, but because facilities receive their power supply from the municipalities, it's the municipalities that exempt each facility if there's a need for them to do that. But I think the key thing is the fact that under the circumstances, the health facilities as they are built with the norms and standards, each one of them should have a generator, in the conditions that there's a failure of electricity supply, the generator kicks in. But under the circumstances, I think the reality is that the load shedding has been prolonged for a bit of a long time, that it affects the capacity of the generators. So that's one of the things that has prompted part of the issues that you see that the clinicians are raising in regard to the power supply in the facilities. But that discussion has been taking place with both the municipalities, SALGA and ESCOM, and the Department of Cooperative Governance.
So what is the sticking point? Why can't it be resolved immediately, especially if these are conversations that have been ongoing for a while, as you said?
Yeah, you know, there are processes that would have to be followed to make sure that this gets to be done. But I think one of the unfortunate thing is that it might have taken a little bit of a slow process, because after the appreciation that load shedding has an impact when it was raised, it was not in the seriousness at which that it is now. So probably now we have been driven by the urgency of it, and I think Minister will be able to conclude this discussion as soon as possible.
So, Doctor, and yes, I know the discussions are ongoing, but what this brings to mind is also what has been a long-standing criticism of South Africa and the government in responding to emergency situations, does it not? That yes, load shedding, we were previously mostly dealing with stage 2, but you wonder why it could not have been foreseen that we may see an escalation to stage 4, 5, 6 blackouts, and why there wasn't a plan set out already for that, shall we say, sort of deeper crisis level of blackouts, especially when you consider the critical work that goes on in hospitals where, for many patients, it's life or death.
Yeah, That's what I'm saying, that under the circumstances with the norms and standards of building the health facilities, we have generators that are built with the facilities. So those generators have been in the past been able to cover in the cases where there's load shedding. But you remember, you would know that in those periods the load shedding it will go to level 6 for 2 days, and then the generators would be able to cope with the situation. But now, as I'm saying, that it has been prolonged, so it creates a challenge to the generators, and we think that it's high time that we need to negotiate the exemption with the speedily as is possible, because in the past we've been engaging with the process with all the relevant authorities, but we want to press on them so that they resolve the issue as soon as possible.
The healthcare workers have also been telling us in the last week or so that the generation system or the generator backup plan is also not entirely effective, because it doesn't always work, and when it does work, it doesn't electrify the whole hospital. I mean, also one of the people quoted, the HPCSA president in fact said this, that emergency surgeries are affected in some cases.
Yes, on top of the generators, the minister on Friday would host a media briefing where he would give a comprehensive response to the situation as it entails now, which would make an indication of some of the initiatives that already are taking place in the sector to acquire the other means of alternative sources of energy, like the solar systems and the like. So minister will be able to make that comprehensive report on Friday in the media briefing, which would give a detail of what is happening in each of the provinces and each of the facilities, and what are the things that have been done to make sure that that situation is addressed.
Dr. Tshwale, we will be at that briefing when it happens. For now, thank you very much for speaking to us about the impact of the power crisis on hospitals. Still